Nancy Phillips. I coordinate the Illinois Family Resource Center, and we're going to be doing Building Healthy Parenting for Recovery today. Spend the next hour talking about some things. And this is really going to be a process of just sharing some of the information that's out there, some of the things I've heard. I've done a 3-hour version of this at a couple of conferences and had some really good feedback on the things that seem to come out and that seem to trigger the thinking process. I don't have magic answers, but I've been in this field for over 40 years. I've coordinated outpatient services. I've worked at prevention pretty extensively, especially with training and working with some of the state organizations. And this has evolved out of a series of webinars that we've done in co-sponsorship with the area ROSC. Let me flip this on down. And I love this, Recovery is Possible. Karen Cook's going to be on here with me. She can hop in anytime she wants, anytime anybody else needs to, that's fine. We'll see how much of this we can get through. I've got enough to probably do the 3 hours. But I wanted to talk about how we got to this place. Before Karen came on board, the previous coordinator and I had done some talking about what we were hearing at the ROSC councils that are part of the East Central Illinois ROSC, of which there are 4 or 5. I think there's 5 counties and 4 of the groups. And we kept hearing some things, so we just kind of started keeping track of what some of the needs seemed to be and decided that we would do a series of webinars, our webinars, and that is not a lot of in-depth, but it gives you food for thought. And hopefully we can build on that this next year. It's written in, I put it back in our plan for this next year to do more of these and to build on what we have done this past year. So I'm going to let Karen talk a little bit about what ROSC is. If any of you don't know, but I looked at the list and I recognize some names, so I know there's some of you that understand it very well. And I think that's great. There'll be some good input, because we're going to address this not just from looking at the individual families, et cetera, but looking at the whole community impact. So Karen, I'll turn it over to you for a minute.
Good afternoon. Thank you everyone for telling us where you're from today. Looks like we have a great audience with us. Again, I'm Karen Cook. I'm the ROSC coordinator with the Our House. If you're not sure what ROSC stands for, it's Recovery Oriented Systems of Care. And we collaborate with one another to build and empower communities of recovery. So I coordinate, 5 counties. I serve Coles, Cumberland, Douglas, Effingham, and Shelby. So we are located in the East Central Illinois area, and we are expanding for fiscal year 23. We are so excited. We're going to pick up Clark, Moultrie, and Edgar counties. So each regional ROSC works with key stakeholders to develop their local coalitions. Each coalition consists of recovery support service providers, treatment providers, families, faith-based organizations, other social service organizations, individuals in long-term recovery, justice involved, probation, parole, law enforcement, hospitals, school personnel. Honestly, it's a coalition, it's a group that just really brings everybody to the table and make sure that everybody's voice is heard to reduce those barriers that we see in these communities and to enhance our recovery capital. So some of our ROSCs, we've hosted Recovery Month rallies, marches, celebrations. We sponsor overdose awareness events, conduct trainings such as this with the Illinois Family Resource Center. We also hold those monthly meetings with our ROSC committee to expand on our strategic goals that we have in place. We also provide recovery support resources for families and expand and diversify the number of peer-based recovery support groups. But again, I'm just happy to be here with everyone. I'm going to go ahead and put mine and Nancy's information in the chat. Please feel free to reach out to us at any time. Nancy is a wealth of knowledge and a wonderful resource if you already don't know. So enjoy our presentation webinar today. So happy to have you with us.
Thank you. I've been involved with ROSC really since, there we go. Since it started developing in Illinois, I sat on one of the first committees representing families and making sure that they were included in the ROSC councils as they were generated. And I just am such a believer in that. And those of you that participate and help support the communities and the people that are in the recovery process, I really thank you. I come into this, like I said, I've been in the field over 40 years in several different capacities. The Family Resource Center started 8 years ago, and it looked a lot different when it started. And I already see a misspelling. Oh dear. Excuse me. I'm getting over the cough stuff. So let's hope we get through this okay. I'm not sure where I was with that because I just coughed and I could really feel it. I think that understanding Illinois Family Resource Center started out with one purpose with federal funding, and the state of Illinois has picked it up. We are funded by the Department of Human Services, Substance Use Prevention and Recovery by SUPER. And we have gone from really looking more at adolescent issues and how to get their families involved into looking at the whole big picture. How do we get families involved at all ages? What's the impact on families? What's the impact on our communities? And that's why it fits so well in working with the ROSC concept and theory too. And what we're going to talk about today is really identifying some issues related to the impact of parental substance use disorder on their children and the development. This is some very basic, generating some things. We're going to look at barriers for healthy parenting and early recovery, explore the role of extended family and the community in positive parenting recovery. And I come into this not being a person of lived experience for substance use myself, but I come into this as being the daughter of, wife of, mother of, and grandmother of people that have substance use disorder issues. So I have lived in all those roles, and I have a really commitment to letting the world know that families can get better and recovery happens not only for the people experiencing substance use disorder or mental health, gambling, but the families can too, with or without them. It's been an interesting journey, but we're hanging in there and doing good. And by the way, 2 of those people have had long-term recovery. So I am a true believer that it happens. We're also going to I will share some parenting programs available or some resources as we finish this up that can address some of the issues. So if anybody has questions, if you've got some ideas, stick them in chat, and if it's something that we can fit in here or address, Karen will grab that, and if I get a chance, I will look. But I'll tell you a little bit more about the Family Resource Center. Our goal, as I shared, is to provide information to families that have substance use disorder, mental health issues, gambling issues. The gambling's newer, but in the last year, I've done some work with the people that provide gambling services out of the Our House. Our House holds the contract for the Illinois Family Resource Center. Illinois Family Resource Center is a statewide project, and Our House has been so supportive of it and has held the contract since it started. And we also have a gambling program here. And it's been really interesting because looking at the family issues, along with one of the other staff coordinators from here, We've done a couple of conferences talking about family issues related to gambling and the impact of that on relationships and children and just lifestyle. And we've also done some other things around that and are planning to do more this next year. We provide information through a lot of different avenues, and it's to just about anybody at this point, to providers. It's not just to providers, but to providers, to human service workers, to parents, people that call, communities, through a variety of methods. And this is the primary way we get information out there. We have a website, IllinoisFamilyResources.org. The website has just gone through a revision and we've added more information. We've cleaned up some of it and added more information and new pages. We have a page for grand families with the increase of grandparents raising grandchildren, especially in Illinois. We are going to be addressing that a lot through the Family Resource Center this next year. And we actually put a page on there with some drop downs, and I invite anybody that's had an experience. One of the things we're wanting to do is put stories on there. Tell us your story. Tell us how you're managing. Share tips if you're that grandparent or person in the family that's providing childcare. I apologize. I didn't think my voice would give out on me. We also have added a page on gambling that has several drop-down resources that we'll be working with. We have a Facebook page. It's posted about 4 or 5 times a week. We've been doing webinars at least once a month. Next year, we'll continue that. I'm also been asked to do a lot of webinars for other groups. CASA has me doing some training. IABH is doing some separate webinars that'll go out there to different audiences. So those kinds of things are coming in and going on the calendar. Can do technical assistance and facilitation. We can do individualized in-service presentation. If you have a group or an organization, agency, office that you want to take any of these topics and have it fit specifically with your needs, we can do that. And we can take the webinars and provide them directly as an in-service presentation. And with things getting better out there, I can do more of that in person too, which is definitely my preference. I like face-to-face. I like working with people and getting you involved as best I can. That's what my training taught me to do years ago. Do a lot of conferences and exhibits. I just sent in 4 applications for presentations and exhibits at conferences this fall, and have just wrapped up doing a whole series of them this spring. So we are out there, and I read lots of research information. So, excuse me, that's what I keep trying to post. I'm a picture person. This is part of that face-to-face. If I had you face-to-face, we could be doing this a little differently. But when we talk about parenting and the impact that substance use disorder has on parenting and families, I can't help but see this. And I think it's important to understand parenting in recovery impacts all puzzle pieces, all the pieces of the puzzle that are in our environment. It definitely, of course, impacts children. It'll impact a spouse or a partner or a co-parent, whether they've been a couple or not. But if you're co-parenting and somebody's going into recovery, it impacts you. Extended family. If extended family have been providing childcare, have taken over that role, as a person goes into recovery and starts looking at how they're going to parent, what's their role going to be as a parent back in children's lives, it impacts everybody. It impacts the foster care system. When I was doing outpatient coordinating, we worked a lot with DCFS in this area, and we worked with a lot of foster care parents in helping the families get back together and in addressing, parenting issues. And oftentimes that foster care may be through family, but not always. And it impacts our communities. If we have parents that are early in recovery, what role do our communities play? And that's where Ross comes in so strong. Ross councils and the impact of how they can build the community in resources and support is just incredible. And we can make recovery processes a lot safer, a lot better. And of course, the other person that's impacted is the parent that's on their recovery journey. Oh, I apologize. This is crazy because I'm a talker. I wanted to share just briefly, I'm not going to read all this, but I want to encourage you to take a look at some of the work that Dr. Ira Chasnoff has done. He's a pediatric specialist in Chicago, has many, many years of experience in working in the field of the fetal impact. Oh, I've got to rescue her. She brought me water because my drink wasn't doing it. Dr. Chasnoff worked a lot with Prevention First back when I worked there, and did a lot of training for us. He's out of Chicago. And he's also done some presentations in the last 2 or 3 years for prevent child abuse. He was a presenter at the, Metro East conference a couple of years ago, and I encourage you to take a look because he is someone that can really talk to you about the impact of substance use disorder in the families, especially if there was any using during the pregnancy on children. And they do a lot of work with that. And I so admire the work he's done, and how he approaches it and how he provides families. And he talks about families where recovery is part of the process, and how do you work with the guilt, how do you work with the parents and getting them through that, and yet also address the children's needs. So I wanted to make sure that that was put in here. He heads up Children's Research Triangle, which is in Chicago. Recognizing that children whose parents misuse drugs or alcohol, I want to keep track of my time, they may be separated from their parents for short periods or long periods of time for a number of reasons. It may be intervention from children's services. It could be that the parents are incarcerated, and these could all be going together. Parents may be hospitalized. There are a number of reasons. The one thing that sometimes happens, and you want to be careful if you're working with these families, is to look at the role of the children, because oftentimes children will take over that role of the adult. And that's not I've never had this happen to me before when I presented. Knowing that children take over that role is something that we need to address and look at what are the resources to work with that. The impact of abuse and neglect on the children's brains can stretch beyond childhood and into adulthood. And some of the possible impacts include impaired cognitive development, inhibited executive function skills, and a weakened immune system. And the weakened immune system can just be from the stress and trauma they're going through. I wanted to real quickly kind of look through a lot of the trainings we've done and around substance use disorder and the impact on the family. We talk about the family chaos. Any of you that have lived through this, and if you're in a human service field, there's a good chance that probably 75 to 80% have gone through some kind of stressor in the family, or you wouldn't be doing what you're doing. And as we look at the family chaos, we have worry and fear. Shame is a big one that we need to address across the board, because oftentimes that shame that comes with the impact of someone in your family having substance use disorder or mental health keeps you from getting the help you need. And it also creates more stigma. we've got to get rid of that stigma. Guilt, you become super protective around things if you're that family member, frustrated, confused, angry. You may be over responsible. You may be taking care of responsibilities of the person with substance use disorder, as our children might if they're taking over those adult roles. Possibly some abusive behavior, like to rescue. These are things that family members, as people you care about, are going through treatment and then are entering their recovery journey. We need to be addressing these things ourselves. And it's not an easy journey. I've been down that road, actually more than once, because family members relapse just like people with substance use disorder may. It's not a smooth road. There's bumps in the road. You have an intense focus, neglect of self, loss of fun, sadness, loneliness, exhaustion. I just wanted to throw those out there so we can kind of go back and think about what that environment is. The other thing that I think it's important to think about and to remember, especially as we look at our communities, is that it's not just our families that experience a loss, but communities do too. Every time there's a relapse. And I think that those terms are going to start to change. We aren't going to be using relapse as much as some other terms that have been put out there. But we experience a loss through that, or by incarceration, or if there's been death by an overdose or an accident. And as a community, not just families, but as a community, we feel grief and frustration and unsure of what the next move is. Sorry about that. Grief is a natural reaction to a lot of these situations, to incarceration, to someone that has relapsed that you care about and you love. And I think the thing that we're starting to realize in the field, and I've felt this way since I was coordinating outpatient services, that we didn't address grief enough. We'd address all these things in the chaos, but if I had you in a room together and I said, put down what are symptoms of grief and things that aren't being taken care of in a situation like that, and what is family chaos of substance use disorder, and then brought you together, you would find that many of those things check off as the same thing. And the field's starting to do more on that. I'm doing a 2-hour webinar for IABH in June around grief issues and how it impacts families as you're going through the process of living with substance use disorder and how you address it. And we often don't realize, even us professionals, we don't realize that it's grief that's kind of getting in the way of maybe some of the healthier moves toward recovery. Not only for the family members, because they grieve the loss of the time that they have with their family members. If they're incarcerated, they grieve the loss of not having them in the family, along with probably some other frustrations and anger. But there's a grief there of what the person they care about may lose as a result of that. Also, the person with the substance use disorder, I firmly believe, because I've seen it throughout the years, there is grief there around losing their best friend, which is their substance. If they've been using especially for a number of years, you lose that. You often lose that whole culture that you were part of, that became your family, that became your environment. And now you're in a whole different situation. You may want recovery, but there's still a grief process to be addressed with that. I'm going to put this up. I found this. This is actually, it's kind of like the Jellinek chart. And this is around grief, looking at different things that happen. With substance use disorder, it's not always shock and denial to start with, as if somebody has passed, but it's a little bit more of a slower process. But yet you oftentimes will find shock and denial if somebody's picked up and ends up incarcerated. It's not just death that would create that. But it's really looking at the different stages you go through. I'm not going to go through all of these, but I thought it was an interesting picture that kind of fits with when you talk about the substance use disorder field, and we go back to some of the earlier research and everything. The Jellinek charts are still out there and still looked at and still used. This is something I want to share with you as we look at families and the recovery journey of putting families back together and how we can support people. I was really fortunate enough to work with the author of this, and then we developed training out of this that we did all over the state for a number of years, and it's called Breaking the Chain. It's been 20 years ago, but it's still valid information. And as we've evolved in looking at trauma, this fits with trauma. It's right on target, and we didn't call it trauma back 20 years ago to this extent. Looking at when children are in an environment, or adults, where their thoughts and feelings aren't validated, when you try and talk to someone and share with someone what's going on, and that person doesn't know how to handle it, so they act like it never happened. They may even say that to you, or no one believes me. That lack of validation is very damaging to people, especially children. And out of that, they don't get the comfort that we need. It's like, who's going to keep me safe? If you don't believe me and there's craziness going on in my family, where am I safe? Where am I going to go? That's also true of adults that are left kind of hanging in the middle of all that chaos. And then it's not resolved. You don't know how to move on. You can't address trauma unless you're able to have it validated and have some kind of comfort or someone to talk to, and then start to move in on that resolution. It's important to recognize that, especially if you're working with children. You don't want to just act like you don't believe what they say or what their experience has been, because it's their reality. Another thing that we see with children as a result of parental, I'm going to get to looking at how we support recovery here in a minute, but I think we need to look at some of the things that happened before. Looking at the relocation stress syndrome, it's physical and or psychological. This is when children are actually removed from that environment and placed in a different environment. I am a firm believer, out of all my years of experience, and I was raised by someone that was very strong in social work and worked at a high level in DCFS way back in the early years, that children will always be faithful to their parents, even if they're frightened, even if they don't feel secure. So removing them from that is very hard on them, because they also feel oftentimes that it's their fault. I caused this. And when they are transferred from one place to another, relocation stress syndrome can very much so happen. And oftentimes the move is just the beginning, and it starts an adjustment and a grief process that we need to be aware of. And as we start helping parents start to parent again, we need to let them understand some of what may have happened, and they themselves may have experienced some of this. Okay, I want to real quickly run through, some of the risk and protective factors. We just did a training on that in February. Yes, February. So I'm not going to go in depth, but I want to address the one that looks at families and the research that was out there. Some of the first risk and protective factor research was done by David Hawkins and Rico Catalano at the University of Washington in the social work department. And they developed a number, I mean, they did a lot of international work and trainings with this. I was real privileged because Prevention Work did some work with them. I got to interact with them some. I was trained in a couple of their programs. And it was interesting to interact with them on all the different risk factors. And they have 4 different categories, but I wanted to look at families. Family members with a use history of substance use or mental health can increase the risk factors. Just because there's risk factors in place, it's important to understand. That doesn't mean any of these things will happen, but it increases the risk, and we need to take a look at that. As community members, we need to take a look. What are the risk factors out there? What are our families experiencing? Family members with use history, that's one. Close family relationships are protected. So how do we build that? How, if we are working with families, if we're working with someone that's in early recovery, if we're a community, how do we build those family relationships? Risk factor, do not spend much time together. When there's consistency in parenting, when we help parents get those skills, these are ones that oftentimes people coming into an early recovery process, they don't have. And given the issue of the generational chaos and use issues that can happen, they may not have had any consistency in parenting. Parents have trouble keeping track of their young family members when they're out in the community. Risk factor. In families where education is valued and encouraged, and it becomes a part of what is expected, it's a protective factor. Lack of clear rules and consequences. Risk factor, if you can learn how to cope, if stress is coped with. I'm not sure where this came from. It's not spelled right. When you cope with stress in a positive way, that helps. Back to the clear rules and consequences. One of the things that Hopkins and Catalano found was you might have strict rules or you might have more lenient rules, but it's inconsistency that creates the risk factor. Our families need to know where the boundaries are. They need to have the clear rules and clear consequences for those behaviors. And if it's back and forth, that's the risk factor. Then parents who use and involve teens or even younger children in their use, definitely a risk factor. Families that encourage supportive relationships with immediate family in a healthy way is a protective factor. So how do we build that? How do we make that part of the recovery process? If there's family conflict and abuse, risk factor. Sharing family responsibilities and chores and understanding that you're part of what's making something work for all the family members is important. And oftentimes when you're starting early in recovery, you're just getting your own life together. So how can we help parents start that process of getting that structure, being able to take that responsibility, and then passing it on to their children? And another risk factor that they found with families, it's a definite risk factor, is the lack of employment and the lack of being able to provide the things that we're going to talk about here in a minute. And the protective factor that goes with that is the family nurtures and supports each other, and however you can do that. And I think, again, our communities can step in and help do a lot of that too. Comments, questions that I need to be peeking at.
Nancy, we don't have any questions in the chat just yet.
Okie dokie, I can click it open, but then it kind of runs down on my screen. Whoops. All right, I want you to take just a minute because I don't want to run out of time here. I talk too much and then my coughing isn't helping our timing. I want you to think about, what does a parenting role look like? If you have to do a job description for a parent, what would that be? Real quickly in chat, put down 1 or 2 words that would be part of a job description for the parenting role. We'll take just a minute and do that. You can do that while I throw this next one up. Because this also includes what are the issues of healthy parenting as a recovery journey develops, and what are support resources to consider. I've been that parent as you're looking at putting things in there. When my husband went into treatment 40 some years ago, my husband's got 40 plus years of clean, sober, great guy, still got him. But when he came home, we had 3 children. We had a 5-year-old, we had we had a 5-year-old, we had a 10-year-old, and we had a 13-year-old. I had been the primary parent. I wasn't real happy that he was going to come in and take over some of that parenting role. So that's just one model that we were talking about. We have a lot of single parents that are going to be trying to resume that as part of their recovery process. Families look a little different, but I can remember some of those resentments I had going, who do you think you are coming in here and taking back over? So what are the support resources that we can get out there to help families understand those dynamics and what we need to do? All right, I am going to pop down my chat model now, looking at this to see if we're going to describe a parenting role. Structure, consistency, patience, organize. Oh, you're going to fit, you guys are going to fit right in with where we're going. Predictability. Oh, yes. And that's part of children knowing consequences for behaviors, positive and negative. They need to know without just guessing. Being a protector, safety, supervision, consistent, responsibility, role model. If we were doing a face-to-face, I would be handing you out a form that actually has several parts to it around what's the parent role. And I love doing that with people because we get some really good responses. These are all wonderful. Mediator and teacher. I don't think I've had that one come up for a while. Those are good. Good listener. Thank you. You're right on target. Those are things that we need to be able to help people in early recovery experience. How do you get those skills? Some never had them to start with. Some have moved away from them during their use. So let's see where we can go. Let's get down here. There we go. I have to put pictures up. This is where we want our families to be. This is where we want our children to be. This is what we want to do for them. Just put those grins on them and let them chase bubbles and live a healthy life. As we look at the parent role, this came out of several different things that I read, and I kind of put them together looking at the parent role. And then think in terms of someone coming early in recovery. How do we help this happen? The ability to plan and prioritize. If you haven't done that for a lot of years and you're in an early recovery, you're just learning to do that for yourself. But yet that's a primary thing with the parent role. What can we do to help that happen? Be innovative and creative in your thinking. Children need that. Negotiate. Oh, with children and as parents, you need to learn how to negotiate. And you also are doing that in your recovery process. Be a quick learner and adapt to new information. And good communication skills. These are all things that you'll often start that process and not have a strong ability to do, but yet it's something that we need to figure out how to support in whatever environment we're working in, parents earlier in recovery, because the more help they have getting there, the more likely we are to have a successful recovery process. Developmental role in looking at being a parent. Cognitive development. It's important that they be able to work with their children's cognitive development. And I always put in here the example of the transparent brain. I'm a big believer in that. A mentor I had years ago that used to do training all across the United States, and I got to sit through a lot of hers, talked about the transparent brain, where you talk out loud about what you're doing. And this is something that you can teach parents that are early in recovery. Talk out loud about why you're doing something. If you're going to the ATM, it used to be, as an example, if you're writing a check, let them know why you're doing what you're doing. If you're cooking, talk out loud the process. Sometimes you feel like a silly idiot, but children thrive on that and they absorb that. Their brains will take that. So if you have a transparent brain that's teaching them, you're going to be working on their development in a very positive way. Sociocultural development, their physical development, their mental development, and their spiritual development are all part of that developmental role for parenting. And as you're stepping back into that role or wanting to assume it again, you need to be able to think about those things. Oops. This wasn't in the order I thought it would be. I wanted to throw this up here real quick. SAMHSA came out, and it hasn't been that long ago, probably 3 or 4 years ago, and they put the stages of recovery for an individual and a family. And they've divided it into 3. It's just really basic, but I think as you look at families starting in recovery, individual, obtaining sobriety, adjusting to sobriety, this is oftentimes where some of that early recovery is, and then into long-term maintenance of sobriety. You go to match the family with it. Families oftentimes, if you look at the family disease aspect of substance use disorder, now they're just as I don't want to say, well, they've used the term unbalanced. The family system is unbalanced. Knowing that health is a possibility, though, that's true. I believe in my early days that I was probably just as unhealthy emotionally, mentally, with my father's drinking, with my husband's drinking, as they were. However, I learned how to manage that, and that started when my husband went into treatment. And luckily, even back then, 40-some years ago, some places did some really good family work. And families then, as people start to get into their sobriety, you can work on developing a new system that's healthier, and then you can stabilize. And I just wanted to share this, a nice, good little frame to look at. These are 2 resources that I wanted to put out. I've got lists and lists of books, and that's another thing we're posting on the website is every month I'm trying to post several different books that you can take a look at, and DVDs, etc. What I'm going to share with you next a lot of it comes from these 2 things, looking at Sober Mom's Guide to Recovery. When I read that and went through that, I thought, that's got some good points I hadn't even thought about. And then the other thing, Everything Changes, Help for Families of Newly Recovering Addicts. They talk a lot about boundaries and where the boundaries are as someone's going through recovery. So I just wanted to put those up there as a resource. But this is what I found. Oops, we got 15 minutes. We need to get going. I may have to do another one of these to finish it. What came out of this is we know that issues of recovery and parenting, this all fits together. How do you become a stronger parent? Meeting basic human needs, reestablishing your parenting role. What has it been while you've been using? What has it been as you've been through treatment, if you've been through treatment? What is that parenting role? And then what's the legal status? Have they been placed in guardianship? Have they been placed in foster care? And that often raises the issue of then who's the boss? If you have your children living with a family member or in someone else's care, and yet you're visiting with them, then whose boundaries for child behavior do you have to follow? These are all things that you have to take a look at. And those of us that are in the environment of working with families can help that, can help facilitate that. Who's taking care of the health care for yourself and your child? How do you get them there? If you're looking over here at the whole transportation, can you get them there? Did you lose your license at some point? Is that something you have to work at so that you can take care of your children in the way that you should. Balancing recovery and parenting responsibilities came up in a lot of the resources I've read. How do you do that? If you're going to, self-help meetings, whatever that may be, whether it's Al-Anon or AA, NA, Celebrate Recovery, whatever, and you're away from your children, how do you balance your parenting responsibilities with that? How do you get care for them while you're doing what you need to do? Then the issue came up in the book that his mother wrote about relationship issues. She really struggled with, she was divorced due to her substance use disorder, had gone through treatment, pretty committed to her recovery, but she also wanted to date. Did she date? Could she date? How did she do that? What were the relationship issues that she might have out of that? And she had interviewed a lot of other mothers as she wrote this. I mean, the same's true if it's a father in that situation who's taking over those parenting roles. You want to make sure those relationship issues don't get in the way of your job as a parent, and the safety issues of relationships. Is that person that I'm dating and might be bringing into the environment somebody safe for my children to be around? Should I be doing this? What am I doing? How do I introduce people into their lives? And then if the relationship ends, how do I address that? All those things are things that need to be worked through as we have parents coming into early recovery. The other thing is safety of a housing environment. Where are you going to live? Where, even if you don't have full guardianship of your children or full custody, and when they're coming to visit with you, when they're coming to stay with you, what's your housing environment? And is it a safe one? How are you supporting yourself and your family? What are the daycare needs that you're going to need? Whether the children are, if they're in school, that helps some. But I know, especially after the pandemic, a lot of daycare in our area has shut down and hasn't reopened, or have cut down on the number that they have. Where do you get that daycare? Who takes care of your children? Where are you going to find help for that? And the whole idea that you oftentimes feel like you have to be a super mom or super dad because of what they've been through, that's a myth. You just need to be a real parent. The issues continued as we looked at really more that have to do with recovery, and then how do you do that and still fulfill the role of parent? How do you manage your triggers and if you should relapse? How do you take care of yourself? What's that self-care? How do you identify that? What do you do with the guilt that you have about your using time as you get back with your children? What do you do with the exhaustion and loneliness? Recovery is not an easy process, especially early on, going to meetings, going to treatment, figuring out how to put your life back together. It's exhausting and oftentimes lonely, because if you're changing the group you're with, if you're changing that environment and culture that you're existing in, it can be lonely for a while. And how do you have healthy fun? Even as a family, you need to be making memories. How do you celebrate your recovery in a healthy, happy way? And how do you just, again, back to finding time for your recovery efforts? And the thing that came up in several of the materials that I read, what do you share with your child? And that depends on their age. I'm a big believer you have to take a look at their age and what's appropriate to share with them. And you can get some advice and support from that, from people that work in the field, or from the people that are in your self-help groups. Again, this is a comment from SAMHSA, that when a parent experiences substance use disorder, it's important that the family be a part of that recovery process. And even if that just means being educated about substance use disorder and the disease concept, that alone can make a terrific difference. And they provide a lot of information and resources. And some of the things that they ask or that they suggest, we're going to be going through in the next 10 minutes. But before we do that, I want you to place in chat, if you choose to, identify one thing you think your group or community can do to assist parents that are on an early recovery journey. Think about what your relationship is to that. What group or organization do you work for? I recognize names on there. I've got educators, I've got child welfare workers, I've got people that address housing issues, and housing is a major issue for parents in early recovery. You may not have a lot of income and you need housing, and you may look for, how do you get subsidized housing? How do you get into those housing areas that provide an environment that's okay for you and your children? What are the steps you need to take? Looking at those things. So think about that. And the first two responders in the chat, I've got books that I will send you. So make sure that as you're putting your responses in there, that you put your email in too, and Karen's going to monitor that. I give away a book or two almost every webinar, so keep coming to them. Your name may come up. Again, I love these pictures. This is that craziness of how do I balance all this, and then this is where we want to go. I do want to throw in the whole thing about grandparents raising grandchildren. I'm not going to spend a lot of time because we've done webinars on that. We're going to do a lot more in-depth stuff on that this next year. But recognizing that grandparents are often part of that role, and a healthy recovery journey and parenting may not always mean that the parent takes back over the full role of being a parent. It may mean that they co-parent with grandparents or a family member or whatever that may be willing to take on some of that responsibility. They may have a co-parent, the other parent, that will be doing part of that. But I think it's important to understand that our grandparents are continuing to go up in the number that are raising grandchildren or grand families, which means a kinship. Looking at 4% of all our children in the United States. There's a wonderful organization called Generations United that I get a lot of data from now, and I really like what they do, and I love their website. 32% of the children in foster care are actually being raised by parents nationally. And I think this is what's really frightening to me is for every child in foster care, and this is new data, there are 19 children being raised by grandparents or relatives that are outside of the system. They aren't being counted in that. They just have been handed off or have done 30-day guardianships, and then it's just continued. So be aware that that's an important thing. And there's some really good information that came out. The ripple effect, the impact of the opioid epidemic on children and families came out in 2019 with lots of data about what's happening with families and the impact of substance use disorder. This is as current as Illinois has posted. In Illinois, there are over 220,000 children under the age of 18 living in a grandparent-headed home, and more than 100,000 grandparents are caring for their grandchildren on their own. Oftentimes, the parent and grandchild will move in with the grandparents. So that household looks a little different, but it's still not necessarily headed up by that parent. And this is just a list of some of the factors that are listed on the Illinois websites, Department of Aging, DCFS. Grandparents Raising Grandchildren program started in 1996 and has some really good information and resources. And we'll be doing more webinars on resources as well as managing the emotional side of all of that. Got 5 minutes to go, so I want to go through this here. Looking at the information SAMHSA put out, we need to know that if you're working with families or interacting with them, you need effective assessments. You need to focus on the children and their needs as they're moving back into a family. Allow children to discuss their experiences. That goes with that validation, comfort, and resolution that I shared with you. Listen to and record the child's views on what's going on. Don't just write it off and go, oh, that's their, even if it's not totally a true picture, if it's their perception, it needs to be addressed. Identify children who are acting as caregivers so that we can support them and we can help the parents understand how to take back that responsibility. Treat children, parents, and caregivers as individuals. And make sure parents know they're being listened to, because they need to know that they've got support as they move forward. Whoops. It's vital to build safe and trusting relationships with the children if you're working with them so that they can speak out. And this involves teaching children what neglect is and how they can get help. Understand a family can easily suffer setbacks along the way. You may be thinking that things are moving along really good. And suddenly there's either a relapse of use, or there's just a struggle, or there's the loss of a job, or some kind of crisis, and parents need to know that there's a support network that can step in. And what is your role? What is your role in the community that you might be able to help provide that? And again, educating family members and friends and people in the community on the impact of substance misuse in families is really important. And I think this is where oftentimes, when possible, if we've got families that you're aware of and you're working within your community, parents early in recovery need help in making a lot of things happen. You need to make sure that the younger children are being taken to daycare or nursery school or wherever it is that they need to go, that older children aren't missing school, and that all children receive appropriate support with their schoolwork and the things that they need. Community can help do that. And that helps support their parents' recovery journey. It takes some of that stress off the early times. The other thing is making sure children are taken to all medical appointments and checkups, including dental. Even if it's just offering a ride for a parent that we know is struggling with getting their children out there. I'm just going to check things. Okay. Making sure children get to the different appointments that they need. Whoops, there we go. And I love this picture. Kids need to know that they're safe, they're being taken care of. Parents need to know that there's a way for them to become a better parent and take care of what their children need. Education and emotional support can be offered in a lot of ways. Family services, self-help, professional services, faith-based groups, hospice. If we're dealing with grief and loss, hospice is a wonderful resource. And a lot of times we wouldn't even think of using that. Al-Anon, Nar-Anon, Gam-Anon, Celebrate Recovery Smart. These are just some of the supports that are out there that we can help offer families in early recovery. Okay, I've got 1 minute left, but I'm going to take 2. Real briefly, we are getting ready to do a training with the National Association for Children of Addiction. We've got 4 teams from all over, from around the state of Illinois. They're going to go through this training called Celebrating Families, and it's for families that are in a recovery journey, on a recovery journey. And it addresses children from age 0 clear up through whoever may be helping parents on that journey. And we're going to be expanding that even more next year. We're going to pilot these 4 different sites around Illinois this year, and I'll be excited to share with you the outcome of that. I have worked with this curriculum some, and I love it. Strengthening Families program. This is a DVD you can get from them, and it's very useful. Strengthening Families has a lot of different versions. It's been around for 30-some years. Carol Comfer has been working with this for a long time, but this DVD is a good resource because you can do it in the home, and you can do it in your office without actually putting together groups, formal groups. Competent Parenting and Recovery. I love this DVD. It's from Hazelton Betty Ford. It is a series of 2 and 3 minute sharing of parents in recovery and what their journey is. And this is new. It only came out about a year ago. Competent Parenting and Recovery. This is a wonderful book. I read out of it when I do the grandparent webinars. Sometimes it's grandmas and grandpas, that it kind of explains the feelings that both children and grandparents have. What makes a family? These are resources you can use for kids, but it's wonderful for parents early in recovery to help spell out the dynamics that they may be dealing with as they put their family back together. Our grand family. This actually, the book actually flips so that it can be used to express what it's like for grandparents and or family members that take over that role and then may have to hand it back. That's hard. It's scary. I'm in there. We've got a 4-year-old we have guardianship of. She now spends a lot more time with both her parents. That's scary for me, but yet it's something that we know needs to happen. So, learning how to manage that and keep your sanity is important too. And here we are. This is us. This is IllinoisFamilyResources.org. Visit. I would love for you to submit some stories that I'd like to put on there if you know of any that need to be shared. And then this is my email address. So don't hesitate to email me. Let me know, is there anything that somebody you might take a look at the chat, because I want to look at the Crisis Nursery of Effingham. I've been to some workshops when they presented. I've met people since that started. Wonderful ideas out of there. I am seeing in the chat some really interesting things. I'm liable to be getting a hold of some of you people. And please, please, please be there as an organization, as a neighbor, as part of your job, as part of your community, as part of your faith organization, and help support these families that are on an early recovery journey, because that's what we want, is a success for them and their children. Okay, there should be a survey come up. Karen, any comments as we sign off?
I don't think so. There is some great information in the chat, some great contacts for everybody to look at. And I got the 2 winners for the book. Have Elizabeth Olson. I got your email. Thank you so much. And Felicia Misselli. I hope I didn't mispronounce that, but I probably did. So I have your email as well. Congratulations, guys, on these amazing books. But thank you guys for coming.
Okay. So as I end this, the survey should come up. It's supposed to. And please share. Okay. Just wanted to be sure. Share anything that you can back with me, because I would love to have your input. Bye. Thank you.